Hello, my name is Emily, and today I'm going to be talking to you about Parkinson's disease. What is it? What are the signs, symptoms, and the best treatment options? So, Parkinson's is a disease that about 60,000 Americans are diagnosed with every single year, and it's currently affecting a little bit over 1 million people in the US population. So, what is Parkinson's? Parkinson's is a chronic progressive disease that affects the nervous system, and it can be marked by tremors, rigid muscles, and slowed, imprecise movements. It's also highly correlated with a dopamine deficiency and a degeneration of the basal ganglia. Both of these are important with balance, coordination, movement, sensation, emotions, all of those type of things. So, signs and symptoms of Parkinson's, probably the biggest is tremors. Tremors will usually occur in the arms and legs as opposed to the trunk of the body, and it makes it really difficult to grasp things. So, holding spoons to eat, holding any utensil, really, holding a pen, so it makes it hard to write, things like that. Other signs and symptoms include slow movement, rigid muscles, poor posture and balance, lack of unconscious movements, and slurring of words. So as the disease progresses, the symptoms, you'll begin to get more of them, and they'll get worse. Some risk factors are family history, your age, your gender, and other environmental factors. So it's a hereditary disease, so if somebody else in your family has ever been diagnosed with it, you are definitely at a higher risk. Your age is important, so people tend to be diagnosed with the disease ages 60 and older compared to the younger population. Your gender, so men are actually 1.5 times more likely to be diagnosed with Parkinson's than women are, and some environmental factors such as smoking, pesticides, chemicals, things like that. So here's a chart basically, and it's just going over the age as compared to how many people are diagnosed with Parkinson's. And as you can see, the numbers rise as the age grows. 80 plus is the highest number of people who have it, then 70 to 79, 60 to 69, and few people in the 40 to 60 range. Here's another chart comparing men and women. So the men are the green line and the women are the blue line. You can see more men, like I said earlier, have Parkinson's than women do. So for the other risk factor that I was talking about, the environmental factors, this has become more of an issue than it was originally. People didn't think it had a huge impact, but it actually does. So a study conducted in November 2016 that was published in the Parkinsonism and Related Disorders Journal focused on environmental factors such as pesticides and smoking, and they actually found that there was a really high correlation between people being diagnosed with these and also people being diagnosed with Parkinson's and being exposed to these. So management of Parkinson's. So exercise is best, definitely. While people think that because Parkinson's affects your balance and coordination, that exercise is bad or can be harmful, that's actually not the truth. It's completely opposite of the truth. Exercise has been proven to actually help with symptoms. Research has shown that physical activity programs promote a significantly positive effect on cognitive function, speed, processing, attention span, and mental capacity among those living with Parkinson's disease. A study was actually conducted to evaluate the effects of exercise on people with PD, and the results showed that those in the early stages who participate in high-intensity exercise can improve their gait speed, step and stride length, as well as hip and ankle joint excursion. To deal with a lack of balance, exercises can be modified according to the severity of the disease. Doing exercises such as chair sit-to-stands still allow the person to be active but keep them safe and comfortable. Because this disease typically affects a population of 60 years and older, modified exercises that incorporate chairs and railings will decrease the risk of falls and injury. A sedentary lifestyle will only progress these symptoms more quickly. And then also to add to the already numerous benefits of exercise is cheap. It can be free. It's very cost effective. If you have a chair and maybe some weights, that's all you really need to get a workout in. So what type of exercise is best? Recommendations are things such as yoga, Tai Chi, water aerobics, all things that help with balance and coordination and are fairly easy to do for an older population, especially when balance and coordination issues are present and the possibility of tremors and lack of ability to grasp things. The typical recommendations say that an individual should get at least, but they're not limited to, 150 minutes of exercise per week of light to moderate intensity exercises. Vigorous activity can be performed, but it's best to consult your doctor before doing so. These are a few alternative treatments. So you can prescription medication, which is pretty common, surgical treatment, medical marijuana, and over-the-counter medications. All of these will help with symptoms. However, you can have side effects, and they're still definitely better when they're paired with exercise. So for my case study, my patient was a male who's 64 years old. He's a non-smoker. His BMI is 25, so it's fairly high, but he's not in the obese category yet, just slightly overweight. His blood pressure is 125/80, which is a little high, but he's not hypertensive. His total cholesterol is 192, so that's good, and his blood glucose is 90. So he was diagnosed with Parkinson's 2 years ago, and his symptoms are not at a severe state yet. He does have some trouble with balance as well as his ability to grasp small objects, and he will have tremors from time to time, but they're not continuous. Okay, for some other demographics about him, he is fairly sedentary, but he does take his dogs on walks for about 10 minutes a day. Family history: his grandmother was diagnosed with Parkinson's in her early 70s, so about 10 years after he was. So his is definitely in the earlier range, and he's also a man, so that definitely probably had something to do with his diagnosis. As I said earlier, men are more likely to be diagnosed than women are. Medications: he's on carbidopa, levodopa, which is a common medication for people with Parkinson's. It helps control the symptoms. For the main side effects, it's usually nausea and lightheaded or dizziness because of hypotension. So it's important to be mindful of that when making an exercise program. So for recommendations, I recommend for aerobic exercise, light to moderate aerobic exercise for at least 30 minutes a day, 3 to 5 days per week. The 30 minutes should be broken up into 3 10-minute bouts or 2 15-minute bouts to start until he feels comfortable doing all 30 minutes at once. I recommend that he continues walking his dog, but for a longer period of time and maybe more than once a day. This will help with breaking it up and making it easier. Also, I recommend water aerobics 1 to 2 times per week. This will be a really good way to incorporate some moderate intensity exercise without putting his balance or anything like that at risk, so he won't be at a high risk for injury. For resistance training, I would suggest 2 to 3 times per week of sub-maximal exercise. So things like bicep curls or straight leg raises with weights that tie around his wrists and ankles, as opposed to holding weights, because he sometimes has trouble grasping stuff. I wouldn't want him to be holding a weight and then drop it, and he could potentially hurt himself. I think the wraparound weights would be much better for him. For flexibility, I would recommend dynamic stretching, but static stretching would also be okay as a start until he gets more comfortable. I would also recommend yoga, not on a daily basis, but yoga should be done 1 to 2 times per week, and then he should also incorporate the poses he learns there into his flexibility that he does at home on his own. So here is a couple websites that I think are really helpful. If you have any questions or want to learn more about Parkinson's, this will give you everything you need, and they also have references so you can contact people to learn more. So thank you for listening. I hope that you learned more about Parkinson's, and if you have any questions, definitely check out these websites to learn more. Thank you.